Welcome to Community Health TV. Kindly help the channel by subscribing, liking and sharing. Today's topic is on hypertension. Kindly watch and listen to the end. Hypertension, also known as high blood pressure, HBP, is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. High blood pressure typically does not cause symptoms. Long-term high blood pressure, however, is a major risk factor for coronary artery disease, stroke, heart failure, atrial fibrillation, peripheral arterial disease, vision loss, chronic kidney disease, and dementia. High blood pressure is classified as primary, essential, hypertension or secondary hypertension. About 90 to 95% of cases are primary, defined as high blood pressure due to nonspecific lifestyle and genetic factors. Lifestyle factors that increase the risk include excess salt in the diet, excess body weight, smoking, and alcohol use. The remaining 5 to 10% of cases are categorized as secondary high blood pressure, defined as high blood pressure due to an identifiable cause, such as chronic kidney disease, narrowing of the kidney arteries, an endocrine disorder, or the use of birth control pills. Blood pressure is expressed by two measurements, the systolic and diastolic pressures, which are the maximum and minimum pressures, respectively. For most adults, normal blood pressure at rest is within the range of 100 to 130 mm mercury, mmHg, systolic and 60 to 80 mmHg diastolic. For most adults, high blood pressure is present if the resting blood pressure is persistently at or above 130/80ths or 140/90ths of a millimeter of mercury. Different numbers apply to children. Ambulatory blood pressure monitoring over a 24-hour period appears more accurate than office-based blood pressure measurement. Lifestyle changes and medications can lower blood pressure and decrease the risk of health complications. Lifestyle changes include weight loss, physical exercise, decreased salt intake, reducing alcohol intake, and a healthy diet. If lifestyle changes are not sufficient, then blood pressure medications are used. Up to 3 medications can control blood pressure in 90% of people. The treatment of moderately high arterial blood pressure, defined as greater than 160/100ths of a millimeter of mercury, with medications is associated with an improved life expectancy. The effective treatment of blood pressure between 130/80ths of a millimeter of mercury and 160/100ths of a millimeter of mercury is less clear, with some reviews finding benefit and others finding unclear benefit. High blood pressure affects between 16 and 37% of the population globally. In 2010, hypertension was believed to have been a factor in 18% of all deaths, 9.4 million globally. Signs and symptoms. Hypertension is rarely accompanied by symptoms, and its identification is usually through screening, or when seeking healthcare for an unrelated problem. Some people with high blood pressure report headaches, particularly at the back of the head and in the morning, as well as lightheadedness, vertigo, tinnitus, buzzing or hissing in the ears, altered vision or fainting episodes. These symptoms, however, might be related to associated anxiety rather than the high blood pressure itself. On physical examination, hypertension may be associated with the presence of changes in the optic fundus seen by ophthalmoscopy. The severity of the changes typical of hypertensive retinopathy is graded from I to IV. Grades I and II may be difficult to differentiate. The severity of the retinopathy correlates roughly with the duration or the severity of the hypertension. Kindly visit a community health center.